Olutasidenib is a very interesting drug. It's a novel, new inhibitor of IDH1 mutated AML. As we know, IDH1 mutations occur in about 8 to 10, 15% of patients with acute myeloid leukemia. And we know that inhibition of IDH1 mutation has been effective. There's been already other drugs that have been developed in this context. This drug is a new, very potent, very selective inhibitor of IDH1, and in this study, which is the pivotal phase 2 study, there is that includes more than 150 patients. These patients were treated with this drug. They were all refractory, relapse. They all had the IDH1 mutation, and they all received the dose of olutasidenib at 150 milligrams twice daily. And it's an older patient population. The median age is more than 70. And yet we saw very encouraging levels of efficacy with this drug. The primary endpoint was CR plus CRh, and that response rate was 35%. But notably, the great majority of these responses are actually CRs, 32% CR rate. If you add the others like CRIs and PRs, the overall response rate is 48%. So very good levels of response. But perhaps the most interesting observation is the duration of remission. The duration of the CR plus CRh was more than 2 years, 25 months, and for the CR is 28 months. So very high levels of CR and very durable responses. And the treatment was very well tolerated. And before that, we also saw transfusion independence in a high number of patients. More than a third of patients achieved transfusion independence, and it was higher in the patients that had the CR or the CRh. And the treatment was very well tolerated. Differentiation syndrome we know occurs with these agents. 14% of patients had differentiation syndrome. In most instances, it was managed with interruptions and supportive care and steroids and things like that. Liver toxicity is the other adverse events that we saw in some patients, but it again was manageable in the great majority of patients. Notably, we saw minimal QTc prolongation, so it becomes a very promising new agent for the management of patients with IDH1 mutated AML with high levels of response, very durable responses, and very good safety profile.